Lagos State Primary Health Care Board recently had its quarterly review meeting in Lagos, Nigeria, ably and well supported by WaterAid Nigeria. Highlights of the meeting included a charge by the Lagos State Director of WaterAid Nigeria in the person of Dr. Adebayo Alao on the Lagos State government to reciprocate the projects carried on by the duo of Kimberly Clark and WaterAid Nigeria in two local governments area of the states, viz. Ojodu LCDA and Ikorodu North local government, so that the wash intentions, water, sanitation and hygiene intentions for Lagos State could be totally met. Another highlight of the event was a brilliant, humorous speech delivered by Dr. Veronica Iwayemi, a medical personnel attached to the Lagos State government, who delved deeply into the ways that medical personnel should relate and handle patients that come their way at their various hospitals. First Nigeria TV's BC Arobusoye was at the event and now reports.
With support of the state government, we scale up these performances and sustain them over time. We at WaterAid have not come to take over the work of the board or the government, rather to work in complementarity manner so that the work we do together can be meaningful across board. At this point, I would like to just pause a little and draw our attention to very little effort that WaterAid has done here. WaterAid is an organization that does not have all the money, and what we try to do is to do what we call fundraising, looking at various organizations and trying to get a little from their CSR, to support us in what we do. And so, the little you see us do is just a little we can. But we have those corporate organizations out there that, because of the quality of service delivery that we also render, they are always willing to work with us. And one of them is this Kimberly Clark, whom we probably do not even need to write proposals to, but we actually approach us to say, we want to work with you to deliver this. And this is already what you are seeing in Lagos State. However, we have come to work as partners to government so that we can put joint hands together to improve on what we are expected to do. In most cases, what we hear is, yes, you have done this, but we are Oliver Twist. We want more. Oliver Twist, we always ask more. This is always the case with us, and this is what we always hear. We would like to say that with the little we have done, we should now go beyond Oliver Twist. We need to now be in the driver's seat to see how the little we have done with you can be taken forward. That the little capacity we have built, the little facilities we have rehabilitated, the little equipment that we have brought, how can we also leverage on this and move this forward so that we can scale up the little that WaterAid has done and we can work together. I want to cite an example of an agency here in Lagos that we have been working with for 2 years now, and that is the Lagos State Wastewater Management Office, SWAMO. I was in that office yesterday and I couldn't believe what I saw. The entire building has been transformed. The rehabilitation, very fantastic. The conference room that used to have fallen off tables and chairs have been refurbished. We have TV screens, very large TV screen in the conference room, in the general manager's office. All the windows, the doors have been fixed, painting has been done, and everything is just looking shiny. And I was, wow, what is happening here? Am I sure I'm in the right place? So I went in to see the general manager, and I was asking him, how did you do all this thing? This man is less than a year old. Maybe some of us know him, Engineer Femi Afolabi. And I asked him, what happened? How have you been able to do this? He said, don't mind, it's still the same office, it's the same funding they have been receiving from government that they are used to do all of these things. And I said, well, we worked with the previous general manager before he retired for close to 3 years. And all these things, we are not like this. What has happened? They say, well, it's all about how you are able to manage the little you get from government. A government will not give you everything you need, but the little they give you, if you are able to put it to good use, this is the result. That was his word to me yesterday. And I was baffled, I was amazed. Honestly, it was a very great transformation. And this is exactly what we are saying, that from the little we are getting from government, can we make impact? Can we make a difference? This is the charge that we are bringing to us. Can we make a difference in our PHCs from the little that we are getting from government? Therefore, I would like to charge us to be more steadfast and resilient in our approach for improved service delivery. To this end, WaterAid would like to place the following demands on the board, and we hope that these demands will be attended to. I hope you have your pen and paper to write them down. Number one, between now and next year, can we replicate Ogbamodel PHC in at least one other PHC in Lagos State? Not necessarily in Ojojo LCDA. Then you invite WaterAid to be a guest for commissioning. That's our demand number one. Demand number two, the wash fit training and the assessment of the 4 PHCs across the district that was done. Can we have the final reports that include the identified gaps and a plan of action of how the gaps will be covered in the next 12 months? Demand number 3. Can the board set up a monitoring team or devise a method of how a monthly wash routine checks in all the PHs will be conducted and reports reaching the board for actions to be taken? Well, this may be Herculean, but it is not impossible. Number 4. Can we have a sustainability plan for Ogba and Odola PHCs that have been rehabilitated for at least the next 5 years following the signing of the MOU after commissioning? Lastly, as we bring the KC project to a gradual close, what is the assurance that this level of quarterly review meeting will continue beyond the project phase? When we have that assurance of its continuity, what outcomes will these quarterly meetings be producing? In conclusion, as we bring the KC2 project to a close, WaterAid would like to assure you of its continuous support in capacity and skills development towards improving primary healthcare delivery in Lagos State. We will not say that because we have ended the Clark projects, and therefore we have nothing to do with you again. It's just that the skill may be lower than before. We may not have the funds to do the level of rehabilitation we have done in Odola and Oba. We may not have the funds to gather you together again for one level of training or the other. But again, our little support to you in terms of capacity and skills development still continue with us. We will continue to work with you. We would like you to even be more innovative and throw challenges to water aid. To say water aid, following your capacity development for us or with us, following what you have achieved with us. This is our next thinking, and this is what we would like to do. We would like you to support us in this area or in that area. That's what water aid will be willing to do. We want to see the proactiveness coming from you. We want to see the ownership coming from you. We want to see the demonstration of your commitment to improve primary health care service delivery in the state coming from. And look forward to a more lasting work relationship and partnership with the board and the state in general. Thank you.
I know she's Igbo. What if you're married? You see, we mean good, but the way each person perceives is so different. And unfortunately, the new generation Z or Gen Z is not like us. So we have to up again. And so let's look at how our medical etiquette, our interpersonal communication, and even the psychosocial support. You know, two heads are better than one. I keep telling my team, I don't know it all. So if I mess up, let me know. It's better you let me know in-house. And you know your Bible say, don't you have a mother at home to train you? Because you can't know it all. And so, healthcare, as we know, we deal with people. That's why they don't call us civil servants. We are what? Public servants. And the quality of care we provide is very important. When we do well, nobody goes on Twitter to say, that PHC. But when you do bad, hey. And so, today we're going to be looking at the skills we provide as professionals. Because we are professionals. And easy lies the head that wears the crown. And then, of course, your Bible says, Ajo, Osonjo. Are we offering care with compassion? Are we offering care with empathy? Because until you throw a stone into the market and it eats one of your own, you will not know that you or your colleague is doing things wrongly. I will cite an example. My father recently died of cancer. Because medically they say you don't treat family. I just felt it was being well handled by the urologist and all at one of our major institutes. So I went to deliver and he said, I'm having blood. And I said, what is your urologist saying? He said, Anikashimau. I'm like, which test have you done? He said, biopsy. And they said everything is fine. I said, biopsy is subjected to human error. If it's giving you normal, I hope they're taking from all. So I said, come do MRI. MRI came back with green score 9. End stage cancer. Metastasis to the lungs, to the spine, to the pelvis, and jocular fascia. And I was like, Father, how did I get here? I should have paid attention. I thought he was under good care. That was February 2020. I returned in November 2020 because of COVID. And I said, okay, how far? And he says, nothing has been done. I repeat the MRI. What was seedlings in his pelvis has now eaten into, because no radiotherapy, no chemotherapy, nothing. And it shows me the messages to his doctors. In 1 month, he sent 10 messages. The last one said, please help me. I am in pain. And the doctor said, okay, fine, come. I will refer you to the oncologist. 11 months. And you did not refer to the oncologist. No treatment, absolutely. And this is the father of a colleague. But it should not even have mattered. What should have mattered is, this is a human life. Of course, I didn't take it up, because even within our association, we were saying, don't put it out there, blah, blah, blah. But you see, if we don't start addressing issues, it will meet us and affect us where we don't want to. My father is gone. He actually made me promise not to take it up, because I could take it up. Forget that you didn't even diagnose. After it was diagnosed in court. So we need to start seeing this as human lives and not as data, statistics. Yes, and in my office I see them statistics because I'm looking at data. But on the job, they are human beings that feel once I get in front of that doctor or that nurse, it's just a hospital, they will know what to do. So the onus is on us to know what to do and communicate it. Remember, some of these are lay people, they're not medical professionals. And we must communicate what we're doing, how we're doing it, and what we want them to do to help us to make sure they get better. And that's why our medical etiquette is important. Our medical etiquette starts from the minute they walk into the PHCs. And that's what we need to communicate to our providers in our districts and our LGAs. From the gate man, who's your you know, in Yoruba, it may be acceptable. It's like I pick up the phone and say, hello, Tanya. I'll translate it to English. Hello, who's this? She said, that's rude. Hello, madam. Good afternoon. Can we help you? The same thing, hello, can be said in a polite manner. And so, the onus is on us to ensure a comfortable, respectable environment, not just for the patient, but even for the employee. Because one of the reasons don't japa is because our environment is not perfect. I won't use the word you said because, Sherry, it is our elephant. There's so much, only so little government can do. Our 4 hour. You sit in the bus. You know I drive. Windscreen. Cannot you see left? Who's going to clean it up? It could be their auntie that is a street cleaner. Why can't you put it in your bag when you get home, throw it away? The same way somebody has just knocked this floor and somebody just decides the cork fell down and they're going. We don't pick up and clean up after ourselves. We anticipate somebody will. I don't mind do it. It is we the people. Nigeria is our elephant. If we lift it anyhow, we know. And so, the onus is on us to create a respectful, comfortable environment, not just for the patient, because if it's comfortable, even we are comfortable. And then, of course, our interactions. Imagine you go to the bank, and as you're entering, the gate man says, what do you want? Will you not get angry? why do we permit all these little nuances in our own establishment? We have to start addressing it. And then, people think etiquette is just, no. Even your body language, the way you dress, the way you sit is etiquette. The way you eat. My daughter, a week ago, the teacher said I should send fork and knife and a saucer. She's just nursery too. What is fork and knife and saucer again? And turns out they're teaching them etiquette. How you sit, how you eat. It is crucial, yes. It may not be our culture, but even in Yoruba, they teach us etiquette. And so, next is, there is etiquette in our medical practice. Just like we have the ABC of resuscitation, it's still ABC. Resuscitation is the airway, breathing, circulation. This is the ABCDE. But medical etiquette is also ABC. Appearance, behavior, communication. Today when I was coming, Auntie, what she said, you look good. I'm like, Enna. When I was small, my mom says you dress for where you want, what you want. And what you dress will just who approaches you. A lot of people nowadays don't think about that. Because if I dress with tattoos and all, yes, it's one's right if you want to have body dysmorphic, whatever. But if I dress with that, of course, I'm more area about, hey, you're fine, bang, sharp. If I go for an interview, the first thing is for them to look and say, so, appearance. We were doing an interview for doctors, and one of our female doctors came in leggings and sandal. But because we are at the level of underpa, you just need doctor. You see, with that one already, what you felt disqualified. But you see, my hands are tied. We need doctor. But I'm like, can you come for an interview with leggings? It was okay to go the So that means in the UK you want people, because you have to think about your colleagues as well. Temptation. Because now we're going to age of domestic and sexual violence. If you start wearing that and somebody now feels you are asking, our culture tends to kind of justify rape. She was asking for it. But as a professional, if somebody is coming and they see that kind of person, they will even bypass her before they know she's the doctor. And so, appearance, behavior, some people, they wear their emotions, they're tired, they're stressed out, and the patient is there. Madam, please, what is the key? Go straight to the point. Whereas, some people want to explain everything. That's when they feel like, yes, I have been to the doctor. But sometimes, we have written prescription. So, etiquette. ABC, appearance, behavior, communication. And of course, let's go back. And of course, we've talked about our appearance. I need us to please our appearance. This is just, irrespective of your religion or your culture, you can always dress appropriately. They keep sending circulars. See, Daddy, please, let me stand up. Now you are coming in native. Do you know that he is completely well attired? If this one was not there, I would sanction Daddy with query. HOS will give him query. Because they said, if you're doing native, do complete. So that means even for us, you can see Dr. Akelu there. He has her. Yes. But, thank you, sir. My name is Dr. Veronica Iwayemi Ayovon, and I am the Deputy Director for Medical Services and Disease Control at Lagos State Primary Healthcare Board. Our quarterly review meetings are actually meant for us to be able to dialogue with the local government and the health districts in order to be able to ensure that we're reviewing our performances and also reviewing how we handle cases at the primary healthcare level. Now, it's essential for us to have these meetings because it provides us a way for us to discuss with the districts. It's a management tool, so we ensure a holistic approach to everything we do. Today we were looking at how we address, because we know our exit interviews talk about people, our clients, focusing on attitude of our healthcare workers, and we've been receiving some complaints. And so today we focused more on looking at what can we do to improve things in terms of our interpersonal communication skills, in terms of how we address grievances, our grievance redress mechanism. And so when we have these quarterly meetings, we're able to identify gaps. We review our data, we look at the gaps, and then of course the challenges, and then we proffer solutions to ameliorating these challenges. And these meetings are very important because it allows us to be able to brainstorm together. We're really grateful that WaterAid is supporting this meeting. It's a quarterly review meeting. As you know, Lagos is the center of excellence, and we are focused on providing excellent services, qualitative, efficient, and effective services to the clients at the primary healthcare level. And so the onus is on us to ensure that we are improving on the services we provide. Our services cover from the mother, right from pregnancy up to the elderly. So we provide maternal and childhood services. We also provide services for adolescents as well. And so therefore we cover a huge spectrum. And so in doing so, we are really grateful that WaterAid supported us and is supporting the effort of Lagos State government. We cannot rest on our oars because being the closest to the community, primary healthcare services are essential services, and we strive to make sure that they are affordable, they are accessible, and they are acceptable to the clients that we serve. So when all is said and done, we're here for the people of Lagos, and our hope is to make sure our services are acceptable for all. Thank you.